think the key thing for young people is that they're growing up in an environment where they're speaking to one another and to the adults in their life, and that they're being listened to, and that they felt like they're being heard and that they're being understood. And that crucial modelling is initially done by parents and teachers. If a young person's experiencing adults who are really genuinely interested in them, listening to them, trying to understand their point of view, they're able to then do that themselves with their friends, helps them build meaningful relationships, intimate relationships. And that is the really crucial thing to having good well-being and good relationships and sort of leading a healthy and happier life.
When it comes to children and mental health, in fact, when it comes to children and any kind of important issues in society, I feel that we have a tendency to want to protect them from things. And actually in doing that, we put our children in great danger, particularly when it comes to mental health. Most people with mental illness, that process has started in childhood. We have so many undiagnosed adults who have been suffering through any number of mental health problems from a very, very young age. And they fall under the radar because we tend to either ignore children, put things down to behaviour or phases, or if children are getting help or assistance for mental health, we are misdiagnosing our children and doing them a massive disservice. How can a child articulate that their mental health is not great if they don't know what mental health is? They literally can't have that conversation. Children find it hard enough to articulate and express emotion. You know, at a young age, they're learning how to process anger or to process sadness or to express to express in an appropriate way that maybe they're really excited. It takes a while to learn how to just process everyday emotions. So then factor in complex emotions and trauma and pain and hurt. How the hell does a child do that if you don't give them an outlet or a safe space to do it?
Growing up in an environment where you can openly talk about anything, especially to your parents, where you can talk about your own issues, where you're not, where you're not made feel like you're less because you have a problem and you want to talk about it. I think it's really important. When I was growing up, this was viewed as like something, it's not important. It's just, you're just developing. You're a teenager. You're going through your moods. And I'm like, that's not a good way to approach it. That's just terrible. Things that happen to you as a kid will then follow you until you're an adult. I think like education about these things, especially at a young age, is so important. It's ridiculous that we don't do it more.
It saves the breakdown. It saves the traumatic experiences they have to go through in the future. It saves all of that. And I think how parents can help is by educating them on it and sharing their experiences. If my mom ever told me my mom's been through a lot. Like, I'm not even just going to go into her story because if she sees it, she'll kill me. She's a private woman. She always says to me, like, where do I come from? Because I'm so open and she's like the complete opposite. But like, she's been through so much and until I asked, she didn't share anything with me. But if my mum spoke to me about depression and how that would have easily made me feel so much comfortable to talk to her because I'm like, you get it. The reason why we don't talk to our parents is because we don't think they get it. So it's like, nah, I'm not talking to her mum. She won't understand, man. She's just going to shout at me. She's just going to, do you know what I mean? So we find artists and we find therapists and all these people. But if our parents show them, like, they're human just like us, do you know what I mean? And they've been through stuff that, like, our parents try to forget their past when they get older. Do you know what I mean? When they catch you smoking, you smoke. Mum, you probably tried to smoke too.
We've all got mental health, you know. I think we'd all be lying if we didn't say that we didn't experience anxiety and depression or stress. You know, stress is a common one. So let's sit down as a family and let's check in with each other. And if you are feeling really, really anxious, let's all work around the thing that you're feeling anxious about. If there is something that's causing you to feel depressed, let's look at, is it internal, is it external, what can we do as a family unit and talk about it, you know, and do things like family meditation or whatever, or watch listen to podcasts together or whatever it is to tackle that elephant that is in the room.
For me personally, and there are plenty of ways that people can approach this. So certainly my way is not the right way or the only way. I have 6-year-old daughters, and there are really simple things that we do as a family to encourage them to speak about how they feel. First and foremost, I make a point of asking them all the time, whenever they've been somewhere or engaged with people, I never say to them, have you been good? Or what did you do? It will be, I'll ask questions that allow them to talk about how they feel. What did you like about today? What made you feel happy about today? What made you feel excited about today? And then I might ask, was there anything that made you feel sad? Was there anything that upset you? Let's start just having conversations with our children about how they feel and allowing them to talk is really, really important. Also, letting our children see that we are human. We tend to hide our own emotions from our children, which I think is just not a good idea, because then we are teaching them that we suppress emotion. That's what we do. And suppressing emotion, trust me, is a really, really unhealthy thing to do. And that can actually cause anxiety in children. If you don't talk to them and let them know what's going on, you actually can cause anxiety in your child because you're hiding stuff from them. They don't know whether it's anything to do with them. They don't know what's going on. We have to talk about these things. But in order to do that, we as adults have to become comfortable in having these conversations. I think you have to have age-appropriate conversations with your children, and for every individual, the boundaries are different. But for me, if I'm having a bad week, I'll tell my children I'm having a bad week. And I may even tell them why. If I'm sad, I'll tell them that I'm sad, because I want them to know it's okay to be unhappy and it's okay to talk about it. And if I don't do that as a parent, then how am I leading by example, and how can they feel comfortable expressing? Not everyone's comfortable having these conversations, because not all of us had parents that had these conversations with us. So it's also important that we don't demonize parents for not having these conversations, because they need to know how to. And that's where, government and education comes in.
I think, being a parent is incredibly difficult. And I think sometimes when you're parenting, it can be quite hard to just step outside of the family dynamic. And I think with the help of therapists there, to just help the other person hear the perspective from different family members, and also take on board perhaps how your own childhood, your own parents influence you and affect you, enables one to reflect perhaps on one's own parenting and what's going on in the family. But also, sometimes I think parents do find it difficult to understand what it's like to be a young person today. I think as adults we often think, yes, we do understand it, but actually things are quite different now. Pressures are different, and young people struggle with slightly different versions of maybe what we had when we were growing up. And so I think sometimes having someone else there to help you step back, think reflectively, really listen to the young people about what it's like to be them and what their life is like. And equally for young people to understand maybe a little bit better what it's like to be a parent, where their parent is coming from how hard it is to be a parent as well, I think, in this day and age. It can just help build bridges. And so, we've had lots of cases of families that have come here really on the verge of breakdown and managed to leave communicating, being able to respect each other, and in a much more positive environment. Adolescents' difficulties don't just impact on themselves, they impact on the whole family and their parents and carers. And often parents and carers need a space of their own to be able to talk about how they're feeling, the anxiety that's evoked within them about the young person's difficulties, and also have a space where they can perhaps think and have the help of a therapist to think about the young person and why they're perhaps experiencing the difficulties. I think often parents and carers can feel like they're not doing something right, or, is it my fault that my daughter or son is experiencing this? And actually having someone else there to think about what's going on for the young person, and that it might not be their fault. It can be a whole range of things that have come together to cause the difficulties, but also have a space for a carer or parent to think about how they may be able to support or react differently to the young person is really important. And also a space to really think about how they can keep them safe if there's a risk there, and how they can best support the young person, be it getting them back to school, helping them to make friends, whatever the difficulty might be.
I think there's two things that we've noticed at the Brent Centre, and one is that quite often that first step for young people of reaching out to friends and family and expressing that vulnerability can be an enormously important step. You can really connect in ways with people that you hadn't imagined were possible before opening up. Having said that, there are obviously situations where perhaps, in some families, the stigma is very great to talk about mental health. It's not approved of. In those cases, I think it's enormously important to make a distinction almost between, it's good to talk. It's good to talk to friends and family. It is also enormously helpful to speak to somebody who's trained, a specialist who knows what they're doing. That kind of expert intervention can really have a much faster, effect, especially for young people when they're still at an early stage of life, than just talking over your emotions. So there are two positive ways for young people to connect, and I think the biggest challenge perhaps for young people is not to give up, not to think, there's nobody, there's really there is help out there.
I think people often, when they feel they're struggling with their mental well-being, they feel like they're hesitant about seeking help because they feel like they don't deserve it, or their problems aren't serious enough, and they don't want to waste someone's time. They're worried about feeling silly or looking silly. And I think the most important thing to say is that you must absolutely go out and seek help. It is pretty much the most unselfish thing you can do, is to go and seek that help for yourself, because not only does it help you, but it helps the people around you, your friends and your family. It's not a luxury, it's an absolute need. How to go about where you get help really depends on where you live and who you are as a person. So going to your GP is often a good first port of call for people, because you can sort of talk about what the options are, what kind of help you can access locally, so sort of establish where the resources are, whether there are any local third sector organisations like the Brent Centre working in the area, or other charitable organisations. And also there's a lot of organisations working in outreach like we do here at the Brent Centre. We work with the youth offending team, we work in schools, we have a football programme. So it might, I think people often think about the traditional channels of going to your GP or having to go to a CAMS unit, but actually it may be that you can access help through your school or your college or your university.
Talking about mental health from younger ages is great, to have those open and honest conversations so children and young people feel comfortable opening up. So we do work in schools, we go into schools and give talks about OCD. I think that's really important. If teachers and people can organise those sorts of things, that's brilliant. Often you'll get somebody who maybe feels comfortable talking about their own experiences, going and approaching their school and asking if they can share some information about OCD or another mental health condition. I think that sort of early intervention and that early education is really important, because it helps, if it can help someone spot the signs and symptoms of OCD earlier and they can get the help that they need earlier, that's going to make a massive difference.
I talk to school kids from 11 all the way up to, I think, 18 was the oldest age group that we've done. And I speak to those kids about mental health, body image, self-esteem, and then where the disease of alcohol and addiction can take you if you go down that route. We didn't have anybody coming in talking about mental health when I was at school. We certainly didn't have a guy come in and talk about anything to do with self-esteem and feelings and emotions and all of that stuff, And there's so many times I've shared my OCD story that the students have said to me about things that they're going through, the anxieties that they're going through. Some of them are experiencing depression. We've got a lot of children self-harming and they're able to open up, and that's when I'm able to signpost them to different channels where they can get help. So yeah, love it.
In the past year, we saw over 700 young people. About a third of those numbers came into the centre. Then we see young people in 7 local schools, and we also see young people at the Brent Youth Offending Service. So we have quite a lot of outreach work. And the way it works is quite often we will provide the school psychotherapist. So there might be a number of psychotherapists working in that school. So young people most often may refer themselves, or perhaps there may be a need identified by the school staff, and in that case they will seek out the Brent Centre psychotherapist working in the school, and an appointment will be made. It's voluntary for the young people to come, and they quite often get... We found it really to be enormously effective, actually, to reach quite a lot of young people who otherwise probably wouldn't have asked for help, or wouldn't have gone to their GP or reached out in some way. So the Brent Centre has done a lot of work to go out into the community and engage with people.
Being an outreach makes it as accessible as possible, and that's been a key for us at the Brent Centre. It's been a phenomenal part of the work that we do, that going out and into the places where young people are inhabiting has meant that we see lots and lots of young people that would never ever walk into a clinic or go to their GP, and they can come kind of under the radar and get therapy without even perhaps feeling like they are getting therapy in the conventional sense of it. Every single young person's circumstances are different, and they may well come from a family who has, is absolutely petrified of the idea of therapy. They're worried about a young person divulging family secrets, or it's just, for whatever reason, something that they wouldn't advocate. And in those circumstances, a young person, it may be better for them not to talk to their family about wanting to go into therapy. A lot of young people are growing up in family contexts where there's a lot of abuse, a lot of intimidation. It might not be suitable for them to be talking to their carers or their family about wanting to go into therapy. And with adolescents, they can go and seek that help on their own. So they don't necessarily need to involve or tell their family about it. And that's partly what's so good about working in outreach, where young people can access help confidentially without having to involve other adults if they don't want to. So it's a space that they can completely own, and it's just for them. And actually that will make many young people feel more able to really talk about what they're feeling, and really do some really effective work in trying to understand their difficulties. I see a whole range of different young people between the ages of 11 to 24 who have a whole host of different difficulties, anything from anxiety to depression, self-harm, feeling suicidal, eating disorders, behaviour issues. Often people think if someone's externalising their problems, so they're misbehaving or acting out, that's kind of a sure sign that there's some sort of difficulty. And it's very easy to overlook the very quiet, withdrawn person. But I would advise people to look out for the quiet, withdrawn ones, actually. They may not cause as much noise or be so obviously in distress, but actually they can be suffering and need support and help. So as a parent, watch out for your son or daughter if you feel like they're withdrawing, not talking so much, spending a lot of time on their own in their bedroom, don't seem to really have any friends, not really going out, as well as the more obvious things like getting into trouble or getting into fights, things like that as well.
School became very, very difficult for me. I was getting in a lot of trouble at school. Not only was I getting in trouble at school, I was struggling to do my homework, and I was having a lot of mood swings because obviously I was going through, I often have this chat with my mum in particular when she starts to take on some blame, as she naturally would. I can't believe that I didn't know, or I can't believe I didn't spot it and stuff like that. But in my case, I kept it hidden from everybody. It was really, really hard, but for my mum. But if, for instance, your child has got another form of another subtype of OCD, and they're actually acting out compulsions and talking about obsessions, then acting out compulsions, then and starting to do it on a regular basis, and then hopefully the parent can then pick up on it and just go online and then look for the charities that are involved. There's a lot of misinformation out there, but if you keep looking, you stumble across OCD Action, or you might come across something called Unstuck, the OCD kids movie. You start finding these different resources and educate yourself on it. And then my biggest bit of advice is take your child to see a child psychologist. If you can't afford to go private, then go through the NHS and try and get in front of a child psychologist in the NHS. But obviously the waiting times are a lot longer. But they do have different programs. The NHS have different programs for mental health for children. But yeah, one way or another, try and get them in front of a psychologist, because a psychologist will do the work necessary to help them change their thinking.
For a lot of young people, and especially somewhere like London or Brent, it's quite congested. There's a lot going on. There's not actually that much space physically, mentally, emotionally to kind of reflect, and also to reflect with a trained professional who knows how to guide a young person through the kind of choices and transitions they're making. Just having that space can be enormously important, you know, for a young person who doesn't have necessarily anywhere else to go and really be guided to be in touch with what's going on for them, which can be overwhelming, it can be confusing. And if you have that chance to talk to somebody who understands those transitions in great detail, who's studied it for many years, who's worked with many young people, there's so many different aspects to what's going on. It's mentoring, it's emotional support, it's teaching young people how to reflect on their inner worlds for themselves, which can be enormously transformative. You know, and that's what we see at the Brent Centre so often, is young people coming here and finding that they have perhaps more control over their own circumstances than they realise.
Often young people who find themselves coming somewhere like here at the Brent Centre won't necessarily think they have a mental health issue. All they know is that they somehow don't feel like they would like to feel, so they're struggling with something. And what they want help with is to understand what it is that they're struggling with, because actually they're finding it hard to understand that in themselves. I think the key way that therapy helps someone with a mental health issue is the frame of therapy. And by that I mean that it's a confidential relationship, that it happens at the same time every week in the same place. That's a very containing thing for a young person who may be struggling. It helps them build trust and gives them kind of consistency and reliability. And I think when those factors are present, they then start to feel able to really think about themselves, what they're struggling with, and with the help of their therapist, try and understand perhaps why they have those difficulties and what could be done to perhaps help them. A first therapy session would really be about really listening to what the young person's saying, listening to what's not being said also crucially, and trying to really understand what it is that they are wanting to communicate to you. It can be really, really hard for young people, not just really shy, even extroverted young people, to seek help because of lots of prejudices that exist within their mind, but also I think often they feel a nuisance or they feel undeserving of it.
We've got increased numbers of depression and anxiety, self-harm, suicidal thoughts with children as young as 8 and younger, and we can't meet their needs. So although we're talking about it, I don't know if there's enough positive action being taken when a 10-year-old child has to wait longer than an adult does to get some kind of counselling or therapy. Lots of social change, lots more to be done when it comes to clinical government and policy. Not every child is going to be in a situation where they've got people that can offer them those platforms and that support. So we need our schools to start educating people about mental health as part of the curriculum, not as an extra personal social education thing that it needs to be part of the curriculum. That's one very simple way to address a huge issue when it comes to children and mental health, is teach this as part of the curriculum so that all children have an understanding that mental health is important. It's important to look after your mental health as it is to look after your physical health, and also that people start to differentiate between mental health and mental illness. People hear mental health and go, whoa, whoa, no, I don't have mental health. We've all got mental health. It's the health of our mind. So let's start teaching children about what a healthy mind is so that they can look after it.
Children's emotions and teenagers' emotions are discarded very often. It's stupid. It's really, really stupid. Because teenage suicide is still a big issue as well, especially like with the pressure of education. Not adapting education to a more modern time, I think, is going to be a big issue, because like this system we're using is still old, to say the least. It's ridiculously old.
We don't get taught these things. We have to learn the hard way. Do you know what I mean? Like, we have to have the breakdown first and then have to go back and... I don't want to have the breakdown first. Do you know what I mean? Like, someone has to be able... Someone knows this. This information is out there. This information needs to get added into curriculums in schools. Like, the curriculum's going to have to change. It has to. I just can't wait for that day. Self-love. Why is that not getting taught in schools? That's the most important thing. Like, if you don't love yourself, you literally can't conduct yourself in society. You can't meet people and articulate yourself the right way. You can't... It just affects everything. Like, I would go into it now, but we'll be here forever. That should be a subject. There's so many subjects that should be taught in schools.
We should also be teaching the kids on how to eat well, for instance, because nutrition plays a huge part in mental health. Teaching them about the different aspects of mental health, and then teaching them how they can get help, and talking about it so much that it becomes normal, so that nobody, boys or girls, feel ashamed of talking about it. And if we was actually... the curriculum involved that, then it would be a lot better.
I think schools, they need to be having conversations and hearing young people, taking their views on board, listening to them and conversing with them, because I think when people feel like they're being listened to and understood and heard, they feel good. You know, it's when people feel like they're not heard, they're not seen, they're not being understood, that you know, they start to suffer. I've worked a lot in schools and with youth offending service and personnel in both those areas. I think there's been a massive shift. They're much more aware of mental health. They're more likely to consider a young person's mental well-being when they're assessing them. And they're much more open to professionals like me, child and adolescent psychotherapists, being involved in decisions that are made about a young person's future. For example, if they're going to be excluded from school or not, or whatever the case may be. So I think there has been a big shift, but there is a massive lack of resources. And although these teachers, social workers, youth offending officers are doing their very best to incorporate different aspects of a young person's life when they're trying to work with them, they're often underfunded and under-resourced. And we really need a push to try and make sure that this shift in attitude can be backed up with actual resources. So not only the professionals, but the young people have the help that they need.
There has been a huge shift. Whether that shift is always entirely supported by the services to be there is an ongoing endeavour, I think, for the whole of our society at the moment. Here at the Brent Centre, we see something like 10% of the need that's been identified by Brent Council, local NHS bodies, as to the sort of level of mental health need for young people in the borough. So that gives you an idea of how there's really so much more to be done, and that's only Brent.
We are very fortunate in that we have a research team, so they're able to conduct outcome monitoring for all the therapeutic services that we offer in schools, at the youth offending service here in-house. And so we know from these outcomes that we see big improvements across a whole range of factors, like people feeling less suicidal, stopping to self-harm, making friends, feeling more confident, managing to stay in school, you know, managing to take exams, managing to separate from the family, move away, get jobs, go on to university. So basically helping them achieve the tasks of adolescence and go on to become more confident, more balanced adults, essentially.
I think at the moment society's in this process of almost like exploration. What works here for young people? You know, what is the right intervention for this young person at this moment, and what are some of the things that we're doing as a society that might be exacerbating mental health concerns for young people. So there's a whole number of factors there, but it is very positive. I mean, it's enormous. One of the biggest things about mental health is to be able to talk about it, because then it creates that shift of lessening the shame, lessening the stigma, and it becoming a conversation about emotions, which is essentially what makes us human.